Understanding sexually transmitted infections, or STIs. Sexually transmitted infections, often referred to as STIs, are infections that are primarily spread through sexual contact. This includes vaginal, anal, and oral sex. They can be caused by bacteria, viruses, parasites, or fungi. Some common STIs include chlamydia, gonorrhea, syphilis, human papillomavirus, also known as HPV, herpes simplex virus, and HIV. How to prevent STIs. First, use condoms consistently and correctly. Condoms, whether latex or polyurethane, are effective in reducing the risk of many STIs, including HIV, chlamydia, gonorrhea, and herpes. Ensure proper use during all forms of sexual activity. Second, get vaccinated. Vaccines are available for certain STIs, such as HPV and hepatitis B. These vaccines can significantly reduce the risk of infection. Third, practice mutual monogamy. Engaging in a sexual relationship with one partner who's been tested and is free of STIs can lower the risk. Both partners should be tested before engaging in unprotected sex. Fourth, regular STI testing. Regular screenings are crucial, especially if you have multiple partners or are starting a new sexual relationship. Early detection helps in effective treatment and reduces the spread. Fifth, avoid sharing needles. For those who use injectable drugs, avoid sharing needles or syringes, as this can transmit infections like HIV and hepatitis B and C. Sixth, communicate with your partner. Openly discuss sexual health and STI status with your partner or partners. Honest communication can help in making informed decisions about prevention and testing. Seventh, limit the number of sexual partners. Reducing the number of sexual partners can lower the risk of exposure to STIs. Lastly, avoid sexual activity if symptoms are present. If you or your partner have symptoms of an STI, avoid sexual activity until diagnosis and treatment are confirmed. Immediate action steps for handling STI symptoms and causes. First, seek medical attention. If you experience symptoms such as unusual discharge, pain during urination or intercourse, sores or rashes, see a healthcare provider as soon as possible for evaluation and testing. Second, follow treatment plans. Adhere to the prescribed treatment regimen. Whether it's antibiotics for bacterial infections or antiviral medications for viral infections. Complete the full course of treatment even if symptoms improve. Third, inform your partner or partners. Notify any sexual partners about your diagnosis, so they can also get tested and treated if necessary. This helps prevent further transmission and reinfection. Fourth, avoid sexual activity during treatment. Refrain from sexual activity until you and your partner or partners have completed treatment and received confirmation from a healthcare provider that you are no longer contagious. Lastly, practice safe sex post-treatment. Use condoms and practice safer sex habits to reduce the risk of future STIs. Frequently asked questions or FAQs and answers. First, what are common symptoms of STIs? Symptoms can vary widely, but may include unusual discharge from the genitals, Pain during urination or intercourse. Sores or bumps on the genitals, itching, rash, and abdominal pain. Some STIs can be asymptomatic. Second, can STIs be cured? Many STIs can be cured with the appropriate treatment. Bacterial STIs like chlamydia and gonorrhea can be treated with antibiotics. Viral STIs like HIV and herpes cannot be cured but can be managed with antiviral medications. Third, how often should I get tested for STIs? It is recommended to get tested at least once a year if you are sexually active, particularly if you have multiple partners or are starting a new relationship. More frequent testing may be needed based on individual risk factors. Fourth, can you get an STI from oral sex? Yes, some STIs can be transmitted through oral sex. For example, herpes, gonorrhea, and HPV can be spread this way. Using protection during oral sex can help reduce the risk. Fifth, what should I do if I think I have been exposed to an STI? If you suspect exposure, get tested as soon as possible. Some STIs have a window period before they can be accurately detected. Inform your partner or partners and avoid sexual activity until you receive guidance from a healthcare provider. Sixth, can STIs affect pregnancy? Yes, some STIs can pose risks during pregnancy, including preterm labor, low birth weight, and transmission to the baby during delivery. Regular screening and treatment are important for pregnant individuals. Seventh, are there any long-term effects of untreated STIs? Untreated STIs can lead to serious complications such as infertility, chronic pain, pelvic inflammatory disease or PID, and increased risk of HIV. Long-term effects vary depending on the STI and individual health. Eighth, how can I talk to my partner about STIs? Approach the conversation with openness and honesty. Share your own STI status, express concerns, and discuss the importance of testing and protection. A supportive and non-judgmental attitude helps in having a productive discussion. Ninth, can you get an STI from a toilet seat? STIs are not transmitted through toilet seats. They require direct contact with bodily fluids or mucous membranes during sexual activity. 10th, is it safe to use home STI test kits? Home STI test kits can be useful for preliminary screening, but should not replace professional medical evaluations. Confirm positive results with a healthcare provider for accurate diagnosis and treatment. By understanding STIs, practicing preventive measures and seeking prompt medical care when needed, individuals can manage their sexual health effectively and reduce the risk of transmission and complications.